Hi, welcome to Pennsylvania Newsmakers. And as we enter our 13th year, thanks as always for watching. Well, the governor is traveling around the state pushing his sales tax change. Tony Romeo and Matt Belanger will analyze, and then the health care debate. Can anyone figure this out? Carolyn Scanlan is here. She will analyze Pennsylvania politics in detail and in depth, and it all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, let's start with the big news in Harrisburg. It's not in Harrisburg, it's Governor Rendell. He's doing all of these visits around the state. He's pushing his sales tax idea, this big change that he proposes. Matt Belanger from News 8 WGAL. Let's start with you, Matt. The governor just won't let this go, will he? Well, first of all, explain what he wants to do.
Basically, he wants to lower the sales tax percentage from 6% to 4%, but then start taxing or re-taxing things that over the years had acquired exemptions. And the hope by doing all of that is he ends up with an extra couple of $100 million for the state in revenue. But
over the long haul, Tony, he really wants to take a huge sum of money and put it into the pension deficit of what, $3.5 to $4 billion. Now, you've been around. How many sales tax and income tax changes have you been through in your career?
Well, I've been through a lot of debate about it, and that's the reason why it's a quagmire. I mean, if he actually were to try to get this through this year, you would have endless debate because every group that still wants to maintain an exemption is going to go before the legislature and plead, and then you're going to have senators or representatives who are sensitive to those interests arguing. I mean, we tried this before when the issue of expanding the sales tax was floated for property tax relief, and it just ended up getting caught in quicksand.
Now, there's 74 exemptions. I mean, you look at them. I mean, they cover coffins. I was looking at this list.
The governor's favorite, gold bullion, right?
How did that get to be exempted? I always thought if you could afford to buy gold bullion, you didn't need a tax. You could pay the tax. But at any rate, those exemptions have special interest built into them. Go ahead.
Right. Well, the governor said all along that this is simply the product of effective lobbying, and that's why he wants to get rid of it. But no, certainly, I think it's going to be a hard sell in the Senate, where anything that can be even construed as a tax increase is going to be very difficult to get through. Even though he's lowering the rate, he's still taxing things that people aren't paying sales tax on right now.
Look, there's a myriad of special interests that represent not to pick on lawyers and architects. You can go through the list of them. You're in the Capitol every day. You're covering the goings on. I mean, the lobbying influences on this would be humongous, wouldn't it? I mean, just beyond. I mean, could you pick a larger group of people who to tax?
It's really hard to imagine in a difficult budget year like this with a governor who is a lame duck, although he doesn't want to accept that label. That's what he is. He's in his last year. It's just hard to imagine something as revolutionary, essentially, as this is getting pushed through in a year like this. Again, I can remember vividly just a couple of years ago the hearings that were held when this was explored as an option for property tax relief, and it was just an endless parade of this interest group, that interest group pleading for, no, don't take away my exemption. The same thing will happen.
That's a good point. This is another example of the governor that just won't quit, right? I mean, every idea pretty much he presented in the budget address was something that was at least bandied about during the 2009 budget impasse. And so this sales tax exemption came up. It didn't pass muster last time around, and here we go again.
The interesting thing for me is whether or not he's going to couple this to the budget. Now, he has said that he's not. My recollection is in the day he had his budget address, he said he wouldn't do that. But nonetheless, he is going out on the campaign trail pushing for this. And if he does decide...
I'll tell you something, Tony. I'll ask you first, and then if Matt, you can weigh in. Look, again, you've covered much of this. Do you remember a governor in his last year who was at least as energetic? And I mean, most governors, they can't wait to get out of Harrisburg. I mean, I don't mean that cruelly. They just can't wait. He just doesn't. He's not going away. Matt's point, am I right?
He's not going away, and I guess when I look at this, it sort of, it mystifies me a little bit. Is there's the issue of biting off more than you can chew. I mean, in your last year, kudos for trying to get things done, but this seems to be like a little bit too much to try to do in your last year when you just don't have the clout that you might have had a couple of years ago.
Now we're going to run to a break, and here I'm going to ask. I'll throw out this question. I think the governor can stay around after June 30.
Oh yeah.
He doesn't stand for re-election. Every House member, all the House Every House member and one half of the Senate will run to break when we come back. But here's a theory, and you guys cogitate on this. He doesn't care if he's here on July 15th and July 30th and August 15th, but every member of the legislature does, and we'll get their answers to that question following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
I'm back with Tony Romeo and Matt Belanger. They've been cogitating. They're all trying to figure this out. All right, Matt, look. The governor, he can stay. He can stay. What's it matter? He's not up for re-election. Go ahead. What do you...
Literally, the writing here is on the wall. Even if we could just glean anything out of the budget hearings that have been going on, it's that there's another serious battle brewing. And I'm convinced this could be worse than even last year. I know that's hard for people to imagine, but it could certainly be worse. And the governor, you're right, he has no reason to want to leave Harrisburg. He's going to stay, and it's going to be the last
Tony
stand.
has a smile. But you think they're going to get out of here by June 30th?
No way. I mean, I think
this can't be.
I think he has made it very clear in years past that he does not believe that there's any lingering damage done from missing budget deadlines.
He doesn't. 101 days, the legislature's job performance
he says there's no damage. He says there's no long-term damage to the public.
How about the confidence in the legislature? How about confidence in state government? Doesn't any of that matter?
His point, his allegation was, or his assertion was, after 101 days last year, was we ended up getting a good budget.
So you think they're going to be here after June 30?
Why wouldn't they? I mean, it's been that way for 7 years.
Oh my
and again, you have a difficult budget year.
Look, Matt. He wants a 4.1% increase over the spending last year. That's controversial because the state's running a deficit. Looks like $500 million. He wants to spend $1 billion more than this year. Now, not arguably some of the I'm not getting into whether they're good or bad. I'm merely making the point. In the legislature, is that a big hurdle to pass?
Absolutely. I mean, it's a big chunk of it is for public education, right? Public schools. And again, this time around, it's kind of his last hurrah on that issue that he's championed for years, and he is not going to let up on this.
And one of the interesting things the governor has said about the sales tax proposal is that he's putting the money in a lockbox to be spent after he's gone.
What does that mean?
So he means that means like, so this shouldn't be a problem because it's not like I'm trying to spend money. But Dominic Pileggi, the Senate Republican leader, made the point on the day of the budget address that he thinks what the governor is actually trying to do is institutionalize his spending programs like his education spending after he's gone. So the money will be there after he's gone.
That's like the Social Security lockbox, right?
He's trying. Right. He's trying to justify this on his plan to use the money to, help offset when the federal stimulus money goes away and the looming pension crisis. That's how he's trying to sell it. I don't know if he's going to be successful.
All right. Before you go, I want to let you guys go. Tony, this week, or for the past week or so, Arlen Specter has been hammering away at Joe Sestak for failure to pay his staffers minimum wage, and that's What's the cumulative effect? I mean, he's had Sestak on the defensive, hasn't he, on that issue?
And of course, all the polling data seem to show that he doesn't really need help. Specter doesn't really need help against Sestak.
Right,
he has a comfortable lead, and there hasn't been much of a change in that dynamic. It does seem to be, however, an issue that would resonate with voters, particularly Democratic voters, who are strong supporters of minimum wage laws.
All right. Look, great update. Thanks for coming on. All right, can anyone make sense of the health care debate in Washington? Carolyn Scanlan from the Hospital Association is here. She can. Trust me. Stay with us. We'll be back following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Carolyn Scanlan is here. She's the president and CEO of the Hospital and Health System Association, one of the real experts on health care. Does anyone have a clue, Carolyn, what's going on in Washington? I mean, the president this week says, I'll take 4 Republican ideas. And there's some good things that the American people want done, but they've mangled that process. Go ahead. Give you a few minutes to chat about this.
They have mangled the process, and I think everybody knows their piece. It's, you know, the proverbial blind man feeling an elephant. Everybody's got their, you know, the trunk or the tail or the leg. If you put it all together, there are pieces that didn't fit real well. But in that bill and in the 4 things that the president said that he'd like to add that the Republicans want are things that the American public wants. If you ask the public or the voters, as you do in your polls, do you like the different pieces of the bill? They all say yes. And so everybody wants insurance reform. People want to be able to buy insurance in the individual market if they have a pre-existing condition or they're high risk. If they have insurance, they don't want the insurance companies taking it away from them through what are called rescissions. They worry about the cost of their premiums. That's all in there, and that's one of the things that the Democrats and Republicans seemingly agree on. The problem we have is that the Republicans keep saying start over. Well, they've been debating this for 1.5 years now, even before President Obama was president. And there is no starting over. Everybody knows the issues, knows the pieces. We got 2 bills that passed, one in the House, one in the Senate. The president has attempted to merge them, pick up some Republican ideas. The controversial issue will be the technique in which to pass it now. That it's a, you know, the technical words are filibuster, which the Senate needs 60 votes,
and reconciliation,
where they need 51. And I don't know when we, you know, in doing things in this country, went to needing 60 votes rather than a simple majority.
One of the things that I think has really been debatable and controversial has to do with how we're going to pay for all this. As you know, health care costs going up 4 times the rate of inflation, everybody complaining about the cost. And they don't seem to really have addressed, A, the cost of things, and then the waste and fraud in the Medicare and Medicaid programs. I don't think that comes close to dealing with the money. I mean, we'd like to get rid of it, but what about this? What about the business of the cost? I mean, is there any, is there anything that the federal government can do, or does the marketplace have to do that?
No, I think there are some things, and they are built into this bill. I mean, there are, as we've talked about in the past, the way hospitals and doctors and others get paid is an incentive sometimes for volume, which then drives the overall cost of the program, Medicare, Medicaid, or commercial insurance. The bill tries to incorporate incentives that cause physicians and hospitals to work better together. They create something called accountable care organizations. They pay on something called a bundled rate, so that for a person, for both their their hospital and their post-stay.
One charge?
One payment.
Instead of like fee for individual services. Do I got that?
Yes, a bundled payment. And a lot of, excuse me, a lot of emphasis on quality. You know, we've talked again about how hospitals have been pressing forward. This gives incentives to do that and links into it what was in the stimulus package, which is to the movement to electronic medical records.
Well, I mean, the other thing is about paying for it. I mean, there is this rolling. I want to get on to this, the situation with hospitals and Medicaid and that's important, and we need to get to that. But there is this problem of sort of requiring everybody in the country to have health care. And I know why some who say they want to do that, because you got to get all the people who are healthy to buy insurance so we can help pay for the folks who can't afford it and who need it. And the American people are okay with covering people who don't have coverage. They're not okay at the moment with saying, Carolyn Scanlan, you got to buy this coverage or we're going to pay it. That's a tough, you know, it's a tough sell.
It's become a very tough sell, yet from a hospital point of view, We see people every day who don't have health insurance, who have catastrophic things happen. They then have significant financial impact on their lives, and some of those costs are already being picked up by the people who are paying insurance and by government.
So in other words, everybody who comes in who doesn't have health care coverage, somebody's going to pay for it, whether it's either you, your hospitals, you got to pay for it, or some insurance company will raise their rates because somehow, some way, services that are being rendered have to be paid for at some part in the process, or am I wrong?
No, you're right. I mean, no business, and though we like to think of hospitals as giving care, there are also business enterprises. You can't keep going year after year if you get paid less than the cost to deliver the services.
All right, look, let's shift topics. Everyone who shows up at a hospital or who's covered under the federal state program called Medicaid, that's health insurance for the poor, gets coverage. I mean, gets services. You come, they pay, you do the service, they get, you get the money for the service. But when the money gets reduced, you still have to provide the service, and the conundrum here is that there's less money compared to what you hospitals and doctors and everybody in the healthcare system has to deliver. And where does that stand now? Because that's a huge piece of this.
It's a very huge piece of it. And at the proposed budget by the governor, and we recognize that this is another difficult financial year, cuts the Medicaid payment to hospitals again. So we had some cuts last year, some proposed huge cuts. They were diminished somewhat, but big cuts again this year. And it's a problem because we don't have a service just for a Medicaid patient. It's for everyone. And the less money the hospitals are getting, the more difficult it is. What's astounding to us that in this recession that the country and the state has been going through, hospitals have been the only entities that have maintained jobs. We are the thing that is keeping the economic fabric of the state and every community where there's a hospital together.
All right, we're going to run to break. We're going to continue. I want to talk about this economic impact and how important that is. We'll be back following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back with Carolyn Scanlan. We're talking about this healthcare business, and man, I'm telling you, boy, it's been a long debate, a year and a half, and it's still not settled yet. But I want to come back to this important thing. I mean, we kind of dismiss, oh, well, it's just another federal program, Medicaid. I don't think a lot of people really grasp how many people get their health care that way, how much it costs, what the burden is on the health care. Not burden, I mean, everybody wants to provide the coverage. We want to give medical service. Go ahead.
Well, particularly in this past year with the recession, there are more and more people on Medicaid. And in this state, it's getting close to 2 million people. 1 out of every 3 births is a woman who's covered by Medicaid, and therefore her baby is. I mean, it is a remarkably important way for people to get health care. And it's an important way for hospitals to be able to provide that health care and get paid for it. Now, we always have a debate about whether hospitals are getting paid enough money under the state and federal combined program. But during this recession, Congress and this president recognized that states needed help with the Medicaid program, particularly as more and more people went on it.
Yeah, I mean, I was just going to say, I mean, they can't say, well, you're going to take more people. You can't turn them away. You're not going to turn them away. You wouldn't turn them away. I'm talking about folks who come in, and yet you're going to provide a service. Somebody has to pay for it, right?
And it's become an accepted program. I mean, this program was put in place in the 60s.
1965,
and so for us, we just want to make sure that as we deal at the state level, there's enough money. We want to help state government get more money out of the federal government. So we, in fact, tell our congressional delegation, continue to give the state federal stimulus dollars for Medicaid. It's an important part of the governor's proposed budget. And we think...
Go ahead. How important are the hospitals to the economy of the state?
Well, the hospitals, as you know, we are in just about every county in the state, and 55 out of 67 of the counties, we're in the top 5 employers. We employ over 250,000 people. We contribute almost $40 billion to the economy. And what we do ripples to the rest of the community. It's $90 billion.
People are supplying all sorts of things.
Exactly.
I mean,
so it's not
in counties. You're not only the big employer, but you're probably the main reason why other folks
are in that town
or even have a business.
And
right.
so it ripples up to $90 billion, 600,000 people, and we believe an important part of what's kept this state from sinking further into a recession. So we really want to keep hospitals financially viable in this state.
Yeah. Before I let you go, you know, one of the things that was a huge issue in this state for a period of time, we haven't talked about it for a time, was this whole business of quality and patient care and this new sense of urgency about it. And I know you all were into this and trying to, you know, make some adjustments even before it became, I think, more identified, quote, you know, in the media as a subject of interest. Where does all that stand now?
Lots of things going on. And Pennsylvania, both through government initiatives and hospital initiatives, are leaders in the country. We report on all infections that are healthcare-associated infections. A couple of months ago, there was a report released by the State Department of Health. Lots of information posted online through the Pennsylvania Quality Health Alliance, on hospitals' websites. Lots of staff focused and devoted to making sure that we incorporate into how we deliver care the most current clinical practices, and then monitoring to make sure we do it right.
Yeah, I mean, some of that, I mean, figuring out in a hospital how to make sure that somebody doesn't get some infection and have a bigger problem is a huge deal. But a lot of people come to the hospitals with these problems, and they're not always easy to identify at first.
They're hard to identify, but we do more and more testing now to figure out what's present on admission, what patients are coming into the hospital with.
So, and there's, I mean, and just there's another thing that costs money. I mean, we've got to get out of here, but as always, thanks for coming in. Great update. All right, there it is. We'll see you next week for another edition of Pennsylvania Newsmaker, and as always, you'll like this. Stay well.